For this assessment, muscular strength was evaluated. First was the 1 RM, 1 repetition max, which is the greatest resistance that can be moved through the full range of motion without assistance in a controlled manner while keeping a good posture and technique. The subject should warm up before performing their 1 RM. The subject should warm up for 5 to 10 minutes of low intensity aerobic exercise as well as performing several reps of the exercise for 1 RM with a light load. When starting, the subject should start with an initial weight of about 50 to 70% of perceived capacity. Once initial weight is perceived, the subject should increase weight by 2.5 to 20 kilograms and continue attempts until lift cannot be achieved or perform is not correct. However, with the proper amount of rest between sets, about 3 to 5 minutes, the subject is aiming to achieve their 1 RM within 4 sets in order to avoid fatigue. Once the subject is able to perform the 1 repetition and no more without assistance while maintaining form, their 1 RM has been achieved. Next, the strength-to-weight ratio should be calculated by dividing weight lifted in pounds by body weight in pounds. For this 1 RM assessment, we used leg press, squat, and chest press. Next is reps to fatigue. A 1 RM, which is a maximal exercise, tends to increase blood pressure beyond the blood pressure encountered during a submaximal test, which is reps to fatigue. These considerations should be taken into account when testing adolescents and older adults. For reps to fatigue, rather than doing 1 repetition of maximum weight, the amount of repetitions should be able to be performed 2 to 10 times. Next is the push-up test. When doing the push-up test, men will start in the standard down position with hands pointing forward and under the shoulder, back straight, head up, using the toes as the pivotal point. Women will start in the modified version knee push-up position with legs together, lower leg in contact with the mat, with ankles plantar flexed. Back straight, hands shoulder width apart, head up, and using the knee as the pivotal point. The subject must raise the body by straightening the elbows and exhaling when returning to the down position, until chin touches the mat while inhaling. The stomach should not touch the mat. For both men and women, the subject's back must be straight at all times. The maximal number of push-ups performed consecutively without rest is the counted score. The test is stopped when the subject strains forcibly or is unable to maintain the appropriate technique within 2 repetitions. Displayed above are the results for the muscular fitness assessment. Subjects 1, 2, 3, and 5 were all female. Subject 1 was classified as very good. Subjects 2, 3, and 5 were classified as good for the push-up score. Subject 4, which was a male, was classified as excellent for the push-up score. Subjects 1, 2, and 5 were classified as poor for the 1 RM and reps to fatigue. Subject 3 was classified as very poor for the 1 RM and reps to fatigue, and Subject 4 was classified as excellent.